Of that. Well, that gives you an idea of some of our opening discussion. First tonight, I want to introduce my good friend Phil Rowe. Dr. Phil Rowe, as I said, is an obstetrician, and I think he has some comments about the financing of Medicare and other things as well, and I pitch it to you, Dr. Rowe.
Thank you, Dr. Fleming, and I appreciate you hosting this 1 hour tonight and a chance for us to discuss in detail the health care of this nation. You know, about 4 or 5 years ago, I made a decision after 31 years of practice to think about running for Congress. And one of the reasons was I knew that the health care issue was going to be huge in the debate in this nation's future. And boys, that turned out to be prophetic. Secondly, the thing that I noticed in my patients when I practiced was the single biggest factor that both Medicare patients and my other private patients and patients without health insurance was it was too expensive. It cost too much money to go see the doctor and go to the hospital. If it were more affordable, more of us would have health care coverage. And secondly, we had a group of patients in my practice that couldn't afford expensive health insurance premiums. They both worked. Let's say it was a carpenter. Perhaps his wife worked at a local diner or at a local retailer that may not provide health insurance coverage, and they made $35,000 or $40,000 a year, but they could not afford $1,000 a month for health insurance coverage. And lastly, we had a liability crisis in this country. The other thing that we're going to get into a little later in this discussion today is that, and this is the absolute sacrosanct in health care, is that health care decisions, and I'm going to say this a couple of times, health care decisions should be made between a patient and the doctor and that patient's family. It should not be made by an insurance company, and it should not be made by the federal government. And we're going to talk a little bit later about the Independent Payment Advisory Board that will be making those decisions in the future. Do we need health care reform in America? Absolutely. Do we need this type of health care reform? Absolutely not. It's a disaster. And we'll go into that a little later about what my major concern is for my patients that I left in Johnson City, Tennessee, was how are they going to access a Dr. John Fleming, how are they going to access a Dr. Scott Desjardins, who are family practice primary care physicians, and the group I have at home that I'm in, that I left to come here, have over 80 primary care providers. How are they going to access those? Well, let's go look at where we were in the 60s when I was a young college student. Was that we had a group of people, my grandparents and so forth, who would be retiring, and at that point in time, because their insurance was tied to their employment, if they had health insurance coverage, there was no way for them to get any coverage. They couldn't buy it. There was no way it could be provided for. So the federal government then got involved in this by forming Medicaid and Medicare in 1965. Our Medicare program in 1965 was a $3 billion program. There was no Congressional Budget Office at that time, but the estimates were that in 25 years, so in 1990, this program was going to be a $15 billion program. The actual number was $110 billion. They missed it by 7 times. And in your initial graph right here, if you had placed in that graph, Dr. Fleming, interest on the national debt, the one you show with Medicare, Medicaid, and Social Security, by 2020 or 2022, even at current interest rates, it will absorb the entire federal budget. And that is why we're having this discussion today, is to save Medicare. And I want to mention just briefly, because we'll kick this off later, in the current health care bill, there have been many changes to Medicare. There are increased taxes on medical devices. The President said the other day that, and we're going to talk about next week, I think, in debate, the payroll tax, about how he was a tax cutter. Well, I would suggest that the President read his own health care bill, because there are massive tax increases in that bill. The Independent Payment Advisory Board is a bureaucratically appointed board, 15 people, appointed by the President, and I don't want a Republican President appointing them, and I don't want a Democrat President appointing them, approved by the Senate to do what? To look at this Medicare, as we pointed out, with millions of Medicare recipients each day, and as Dr. Fleming pointed out, 500 to 550 billion less dollars going into the system, more people going in, people living longer, much longer, which is a very good thing. we're looking at a catastrophe for our Medicare program if we don't make some proactive changes now. And how can you fix a system that everybody in this chamber knows is broke? Every 435 of us know it, if you can't even discuss it. If you're accused of dumping grandma off the cliff, if you even talk about a system that I personally am on Medicare. Right now, I'm a Medicare recipient, so I have a vested interest in seeing that this program works for current seniors. I was at Furman University Monday night speaking to a group of college students on health care. It was a privilege to be there. It's a great college, a big turnout of young people. And it was embarrassing for me to look at those young people who are just beginning their careers and to think that we're going to not leave them the same access to care that I have available to me right now. And if you look at these numbers, Dr. Fleming, you see that it is not sustainable. So we have to have this conversation. I want to thank you for holding this 1 hour. I see we have numerous other colleagues here tonight, and I yield back my time to you.
I thank the gentleman, and I see that we've also been joined in addition to Dr. Scott Desjardins, Dr. Phil Gingrey, also OBGYN, Nurse Anne-Marie Burkle, and Nan Hayworth, an ophthalmologist from New York. So we've got a full cadre. If anybody here has a headache or certainly a heart attack, I think they will be very well taken care of on the floor of the House. So with that, I'm going to ask Dr. Desjardins to talk to us a little bit. I think you have an interest in some of this discussion on IPAB and perhaps other things. So love to hear what you have to say, sir, on that.
Oh, well, thank you, Dr. Fleming. And I, like Dr. Rowe, appreciate you holding this tonight because I think there's so much fear, frustration, and confusion among our nation's seniors right now about what's really going on. There's a lot of misinformation out there, and I think it's good that we as healthcare providers can get together and help clear up some of the misinformation, because as Dr. Rowe said, we should never let the government or bureaucrats get between the doctor and the patient. That's a very important relationship, and I think most all patients would agree. How did we get into this mess? It's really kind of mind-boggling that it has come this far. And as you stated earlier, the Democrat plan is doing nothing, and we know that the consequences of that, as per the CBO, the actuary of CMS, Mr. Foster, has said Medicare will be bankrupt by 2020. So we cannot afford to do nothing. And we got into this mess really just by kind of the head-in-the-sand approach that sometimes occurs here in Washington. As Dr. Rowe mentioned, Medicare was initiated in 1965, and at that time the life expectancy for a male was 68. Well, thankfully through good medicine, good follow-up, good care, better drugs, better techniques, the life expectancy has gone up at least by a dozen years. But that being said, there really wasn't any planning for that increase. A program that was designed for on average 3 years of coverage is now 12 years more. And so that's part of the problem. A second big factor is we all knew about the baby boomers. Everyone knows about them. And bottom line is they have started hitting the system at an alarming rate. 10,000 new members every day are entering the Medicare system. And again, something that we've all seen coming, but it wasn't accounted for in terms of cost. And Dr. Rowe explained how that it was underestimated greatly what it would cost in the first place. And we know that people pay into Medicare because that is going to be their health care plan when they retire. That's what was promised to them. So we can't do nothing, and in the Paul Ryan plan we laid out that those 55 and older won't have to worry about it. We know that we can't do nothing, so those 55 and under will have to make changes as you discussed, and I'm sure we'll discuss more. But for those seniors out there that are concerned that the Republican plan is cutting them off or killing Medicare as we know it, simply isn't true. We're trying to preserve, protect, and save it for future generations as well as take care of them. And right now you can take an average couple who makes $80,000 a year, and they pay over a lifetime about $109,000 in Medicare taxes into the program. But with health care costs the way they are now, the average extraction for that same couple is $343,000.
If the gentleman will yield on that point, I want to be sure that that's not missed, and that may be the most important statement made tonight. And I believe you said that through a lifetime, a Medicare recipient will pay in an average of $100,000 or so dollars, but will take out on average $300,000. So what we really have with Medicare is somewhat of a subsidy system, which does not subsidize according necessarily to need. And my point in saying that is Warren Buffett today, because he's over 65, qualifies for Medicare, and if he gets care, I assume would get the same subsidized care. Subsidized by who? Taxpayers, middle class, working class people who pay the private insurance rates. And so in some ways, Medicare has become not just help for the poor and the elderly, but just subsidy for people over 65. And so we're going to have to look at, is there a way in the future that we can even this out where we're not necessarily subsidizing for those who are capable of paying some of their own cost.
Right. And as you say, it's clear that $1 in for $3 out doesn't add up by anybody's math, even Washington's math. So, you know, those factors make it very clear that Medicare is on an unsustainable path. And, you know, I find it very frustrating that so many people are living in fear right now with this misinformation and this, if any of the other members, I'm sure they experienced, as my office did, the AARP here a few weeks ago had seniors calling congressmen to say, you know, don't cut our Medicare. They're referring to the SGR cuts, which actually pertains to doc fix, but the seniors are confused thinking that their Medicare was actually going to be cut 30% or 29, 27%, whatever it is. And so when they were calling my office, I was glad to tell them, yes, we get it. You know, that actually is a cut to physician reimbursement. But what it does to seniors, more concerning, is that it's going to limit their access to care, because physicians right now are in a position where they can't afford the overhead to even keep their practices open. So I think it was good that the AARP brought that to their attention, but it certainly is great that we have the opportunity tonight to clear that up for our seniors, that it's not a cut, a direct cut to their Medicare benefits, but it is going to directly impact their access to care.
Right, absolutely. Well, I thank you for the wisdom of your experience, Dr. DeGillet, and I'd like to turn to Dr. Gingrey here. I believe he's joined us and, of course, has conducted a number. I can't even count the number that I've participated in with Dr. Gingrey with respect to special orders that we've had. And before doing that, just to follow up on what Dr. DeGillet said about the 100,000 in, 300,000 back, I can recall one day in my own practice sitting there and thinking about the 3 patients that I just saw. In room 1, I saw a little lady who was on Medicare who could barely scrape by the end of the month. And she's on Medicare and getting the benefits of Medicare, and God bless her, she was getting them. And then I thought about the second room where there's a gentleman who's a multimillionaire. But you know what? My charge to both of them and what Medicare did for both of them was precisely the same. And I just couldn't quite understand that, especially when I thought about the little mother in room 3 who's on private insurance, 2-paycheck family, baby barely scraping by, paying far more in their premiums than someone in Medicare. And having to raise children, it was her insurance premiums that were subsidizing both the little old lady who was poor and the multimillionaire. We're going to have to do something about that to make the economics of this system work. It is unsustainable, as we know. So, Dr. Gingrey, I would like to ask you if you could give us a few words, sage wisdom on what your perspective of where we are with health care, Obamacare, Medicare, and all the other cares that we're talking about.
Well, I thank the gentleman from Louisiana, Dr. Fleming, for yielding, Mr. Speaker, and I thank our leadership for giving us this hour to focus in on Medicare and Obamacare, formerly I guess called Patient Protection and Affordable Care Act. We all know it to be the Unaffordable Care Act. But it is I think it's very important, Mr. Speaker, and instructive for folks back home, especially our seniors, to look at this body and the other chamber as well, Congress as a whole, and you look at the members who are health care providers, and in this House of Representatives there are 435 members, and 21 of them on the Republican side are health care providers, nurses, doctors, psychologists, dentists. On the Democratic side of the aisle, 3. And you look at the other body, you look at the Senate, and you see 4 doctors on the Republican side, none on the Democratic side. So as we get into this season, this political season, and of course the presidential election cycle, Mr. Speaker, you know, we all know, that we're already seeing the ads. I think Dr. DeJarlais referred to this ad about cutting Medicare 30%. Don't let Congress cut Medicare 30%. And, you know, who cares more about seniors? And I think those statistics are pretty darn telling in regard to who cares more about our seniors. Many of us, in fact, have practiced so long that we're seniors. Thank God we've got good health and vigor and enthusiasm for giving up what has been a wonderful profession, whether we were nurses or doctors or whatever, but caring for people and the compassion that goes with it, to come to Congress, come here inside the Beltway, and really work on behalf of our seniors, work on behalf of getting the health care policy right, but particularly in regard to our senior citizens and the millions that depend on Medicare because either a disability or their age. And so it's the Republican Party, Mr. Speaker. It is the Republican Party that is really working on behalf of our seniors. What did the Democrats do when they were in control for that brief period of time and Ms. Pelosi was the Speaker? They brought the country a whole new entitlement program, Obamacare. It had nothing to do with seniors. It had nothing to do with the poor who are covered by Medicaid and the Children's Health Insurance Program, the S-CHIP program. In Georgia, it's called Peach Care. They did nothing to strengthen Medicare. In fact, to pay for this new entitlement program, health insurance for all, young and healthy people, they gutted the Medicare program. Mr. Speaker, the gentleman from Louisiana has a poster before us right now, the first slide, if you will, and we need every one of us on both sides of the aisle to focus on that. And as he points to the first bullet point, cutting $575 billion from the Medicare program, and most of it in the next bullet is from the Medicare Advantage program. And of the 40 to 45 million people that are on Medicare, most of them because they're 65, maybe 10 million of them because they're disabled and younger. But so many of them, Mr. Speaker, get their care, get their health care on the Medicare program through something called Medicare Advantage, and that's the key word. Why is it Advantage? Because it gives them comprehensive care, it gives them an emphasis on wellness, prevention. It's not just treating disease. It gives them a drug benefit even before Medicare Part D was enacted by a Republican Congress back in 2003. And what did the Democrats do? They took, what was it, Dr. Fleming, $135 billion out of the Medicare Advantage program over a 10-year period. That is a 14% cut. And President Obama says if you like what you have, you can keep it. Well, you can keep it if it's still available, but it won't be. And so, you know, we're here tonight to let the American people know and let our colleagues know, and if we have to hit them over the head with a 2x4 to get their attention, we're going to do it, because they are ruining a great program. And we're health care providers. It breaks our heart. We know, we see the patients. We are at their bedside in sickness and in health when they come to their office for routine checkups. But we're here now, I guess, as policy wonks. It's our colleagues back home. We want to keep them in the Medicare program particularly primary care doctors, seeing those patients, and it just breaks my heart to see what's happening. And I thank the gentleman from Louisiana for managing the hour tonight on behalf of our leadership to make sure that these points are made very clear to the American people, particularly our seniors. And I thank the gentleman from Louisiana, and I'll yield back at this time. I know he wants to yield to other members.
Well, again, I thank the gentleman, and again, Dr. Gingrey serves on House Energy and Commerce Committee that has oversight and jurisdiction in this area. Very important, looking at a lot of legislation. Next, I want to turn to another of our freshmen. We've had a wonderful cadre of freshmen we appreciate so much, and a wealth of physicians, dentists as well, bringing in their years of experience, training, and education. So next I'd like to recognize Dr. Hayworth, Nan Hayworth from New York, and would be very interested, as the viewers are, to hear what you have to say this evening.
Well, thank you, Dr. Fleming, and I add my thanks to those of our distinguished colleague from Georgia in gratitude for your hosting and managing this session tonight. You know, we just had a Medicare telephone town hall today with our constituents in the beautiful Hudson Valley. And one of the questions I was asked, and most of the questions, we had a Medicare administrator with us because it's open enrollment season for Medicare throughout the country, I believe, up through December 7th. So we were very grateful to have a Medicare administrator with us who helped answer questions about some of the complexities of Medicare, because there are a number of them, as you might imagine. But we did get one question that was conspicuous because the gentleman asked me, and it's one that we've all been asked, as Dr. Desjardins was saying not long ago. Why are you, Nan, why are you against Medicare? And I explained to my constituent that you know, gosh, sir, it's exactly the opposite. I want to preserve and protect Medicare. I want to make it secure and sound. This is very important to all of us. To me, as a doctor, I had the privilege of practicing for 16 years. I'm an ophthalmologist, so many of my patients were seniors, and I'm the daughter of two elderly parents, both of whom rely on their Medicare benefits. So the last thing that I would want to do, the last thing that any of us wants to do, is to harm Medicare. We know how important it is, and more specifically, this nice gentleman was asking about our vote on the budget this past spring. And as all of us here know, and as our listeners may not be fully aware, we did pass a budget in the House of Representatives this past April. They may not have heard quite as much about it as they otherwise should have, if you will, because the Senate did not pass a budget. They did give ours 47 more votes than the one proposed by the President, but nonetheless that was not enough to pass a budget. So we've been waiting now, the American public, for at least 2.5 years for the Senate to pass a budget. But in our budget, and Dr. Gingrey and Dr. Fleming have just been referring to the $575 billion that was removed from Medicare by the massive 2010 health care overhaul. In our budget, we restore those funds to Medicare. That is a very, very important fact. We all voted here as doctors, as caring legislators, as representatives of our districts, to restore funding to Medicare, to strengthen Medicare, not to weaken it. That's the last thing we want to do and the last thing we can afford to do. So I think it's very important for the American people to understand that as things stand now, the Medicare benefits that people are counting on are threatened in ways that they don't have to be. So that's something that people should think about, people who cherish Medicare, who receive Medicare, and who have loved ones who depend on Medicare. Medicare is, unfortunately, as our colleagues have discussed, it is running out of funds. When we think about payroll taxes, and we hear a lot about payroll taxes in the news these days, Payroll taxes go to pay for Social Security and for Medicare. And the way these programs were set up, as we all know, but just so that everybody understands, the way these programs were set up, they were supposed to be people would contribute from their paychecks. The money would be kept by the federal government and then returned to them in their benefits in their senior years when they would need them. And you know, that's a you know, that could be a very helpful thing. But as Dr. Desjardins has pointed out, thank the good Lord, people are living much, much longer than they were when Medicare was first made law. So we are facing a challenge because for several decades, contributions to Medicare from the payroll taxes were built up. People weren't taking out as much in their Medicare benefits as they were paying in. And, you know, the baby boomers were not part of the Medicare eligible senior group yet. Now they are. So between our seniors living many years longer, thank the good Lord, I wouldn't trade a day with my parents, nor with any of our seniors, but they're living a lot longer than they were. So Medicare and health care is wonderful in the United States, but costly for a number of reasons. So the Medicare funds that were built up have now started to be depleted. And they're going to run out. It's projected anywhere from 2024 now to 2021. What we all know is that the estimates are probably off the mark. So to take an extra $575 billion out of Medicare is the last thing we want to do. And it's very important for everybody to understand that, because although there are workers in this country who are contributing their payroll taxes now, and those are going to help fund Medicare, you know, when those folks become retirees, Medicare is going to be very different in terms of the funds it has. Medicare that trust fund is going broke. So folks have been thinking about, and Dr. Desjardins, I think in particular, mentioned it. They may have heard three letters, SGR, or about the doc fix, and I'll finish up with this. What is that? You know, what does that mean? Well, when doctors go to, when patients go to visit their doctors and they receive Medicare, as Dr. Fleming was saying, our Medicare patients have a certain fee schedule that we are obligated to follow. And in a lot of cases, that fee schedule is far less than the fee schedule that is set up for our other patients, you know, depending on their insurance and other factors. So Medicare pays doctors and other providers, generally pays less than other programs do. We accept that when we participate in the Medicare program. But to provide Medicare in the United States is very expensive. We have staff that we have to pay. We have overhead. Everybody who has a business, and I had my own practice, a small business, I had rent and supplies and staff and insurance to pay. One of the unique aspects of America in terms of our medical care is that we do have a very costly, what's called a liability system. So lawsuits for malpractice, and we should indeed do everything we can to prevent malpractice, but lawsuits in this country are very expensive.
If the lady would yield,
yes,
I think
of course,
Dr. Gingrey has something he would like to add.
Happy to yield.
Well, and I thank the gentleman from Louisiana for allowing me to take a little time, maybe just a minute,
Absolutely,
to interrupt the gentle lady from New York. She's made such great points. And the thing that I wanted to mention to my colleagues is that if we do nothing, and I think Representative Hayworth pointed this out, doing nothing really is not an option, because if we do nothing, and she talked about those dates, 2024 maybe, but probably closer to 2021 when Part A becomes fiscally insolvent, then what would happen is our seniors under the Medicare program would take a 22% cut in their benefit package, or else we would have to raise the payroll tax 22%. Right. And I'll yield back after making this comment, and I think this is important. Medicare was enacted as an amendment to the Social Security Act in 1965. I guess it's Title 18. We didn't have all the information we need back then. As Representative Hayworth points out, situations were different. People were not reliant back then so much on medication. It was more surgery and that sort of thing. And now we have Medicare Part D. The point is things change. And if you don't change with the times, we would still be watching analog television. And it's just as clear and as simple as that. And for people to criticize what the Republican budget called for in regard to making changes in Medicare so that it remains solvent for our children and grandchildren, and as Representative Hayworth, Dr. Hayworth pointed out, protect it, preserve it, and strengthen it for those that are already on it, not do anything in regard to them, but a phase-in change for our children and grandchildren so they'll have it like we have had it. And I thank the gentlelady for letting me interrupt briefly, and I yield back.
Yeah, since we are beginning to run a little short on time, and I want to be sure we get all of our doctors and nurses, I'm going to recognize Ms. Burkle, very excellent nurse and a wonderful addition to our freshman class.
And I thank my colleague from Louisiana. And Mr. Speaker, I just want to say what an honor it is to be here tonight on the floor with my colleagues and members of the Docs Caucus. I do stand here as a nurse and also the daughter of a 90-year-old mother, so Medicare for her, I know how she depends on the system. But one of the things we didn't talk about in one of my roles in life was as an attorney, and an attorney who represented a large teaching hospital. And about 2 weeks ago, I joined with some of my colleagues on the House floor, and we talked about what this health care law is going to do to our hospitals. And when our hospitals and when our doctors are affected by reimbursements, by Medicare cuts, that really affects our seniors. That reduces their access to care. So the first thing I want to do tonight as a healthcare professional and as someone who cares deeply, and I think that's the beauty of this tonight, us getting together, people who have invested their life in healthcare, who love people, who care about people. This isn't a Republican or a Democratic issue. This is an American issue because healthcare affects all of us. And this is a group of people who really believe that there is a better way. There's a much better way to provide access to health care in our country without jeopardizing that access and without jeopardizing the quality of care that our country has to offer. So the first thing I want to do tonight is reassure our seniors that what we are talking about is protecting and allowing the Medicare system to continue on. But what they need to understand is that the health care law has changed Medicare forever. Medicare is different now than it was before the health care law passed. The health care law cuts, Mr. Speaker, $500 billion from Medicare. And I just want to show on this graph I have to make it clear what happens to Medicare reimbursements. From 2012, you can see where we are. It's a cut of 9.7%. But here, in 2018, Mr. Speaker, the cuts to Medicare and the reimbursements to our hospitals is down 28.6%. I've had all the hospitals in my district come to me and say, this health care law, and they were proponents of the health care law. They wanted reform. They've come to me and they say, this health care law is going to bankrupt us because not only is the health care law affecting their Medicare reimbursements, it's affecting their disproportionate share reimbursements, which keeps many hospitals afloat who treat indigent patients, who treat Medicaid patients. And it also affects their GME and their IME, and we talked about this in the last special order we had with regards to how we're going to keep our teaching hospitals and keep all of our hospitals viable and soluble. So the first thing I just want to leave the message tonight to the American people is we care about preserving Medicare for our seniors. We are not proposing anything in our budget proposal that would affect our seniors and those back to age 55. So we reassure the American people. We care so deeply about health care and the quality of health care, but we are very concerned about this health care law. and why we voted to repeal it several months ago. One of the first things we did when we came to Washington was to repeal the health care law, because we know what it will do to our seniors and to our health care providers. So I thank my colleague for organizing our time here tonight on the floor, and again, we just want to reassure the American people we care about our seniors. We want to make sure they have access to quality care and good health care. Thank you so much.
Well, I thank the gentlelady for a very compelling discussion, both as a health care provider or nurse, but also as a daughter of an elderly mother. Those words are very heartfelt, and obviously it means as much to you that we protect Medicare and health care in general than it would anybody. There's no reason why, just because you're a member of Congress, that you would love your mother any less. So I think that's important words. Well, we're going to move now from a nurse to a surgeon. Dr. Benishek from Michigan has joined us this evening, and let's hear from you, Doctor, and see what you have to tell us.
Thank you. Thank you, Mr. Speaker. It's my pleasure to be here this evening to join my colleagues to talk about Medicare. As you may know, before coming to Congress, I served as a general surgeon in my district for the last 30 years. And many of my patients were on Medicare. And as a practicing physician, I often express to my patients and my understanding wife about our broken health care system here in America. In fact, that's one of the reasons I decided to get more involved in the political process and actually run for Congress. Most Americans don't understand that Medicare will be bankrupt within a decade if we don't do something to fix it. I didn't make this up. An actuary for the Centers of Medicare and Medicaid Services actually provided this number. Now, I think if you ask most 65-year-olds just beginning to use Medicare, most would be very worried to learn that their primary health care provider was projected to be bankrupt within a decade. In fact, according to a recent Social Security Trustees report, Medicare seniors should expect to see a 22% benefit cut, or workers should expect to see a 22% hike in their payroll taxes unless some action is taken. The bottom line is, if action isn't taken today, seniors in the program today, not to mention those looking to retire in the near future, will begin to lose their benefits. Despite these facts, the other side of the aisle has spent the last 6 months attacking us, often saying that House Republicans' attempt to protect and preserve Medicare was in fact destroying it. Are you kidding me? Accusing myself and my fellow physicians in the House of wanting to end Medicare? We spent our careers caring for Medicare patients and are proud now to call them constituents. The real truth of the matter is that President Obama was elected in 2008 with a promise of hope and change. He did accomplish change in America's health care system, but I don't think it's the kind of change that Americans bargained for. Mr. Obama's health care law cut $575 billion from an already ailing Medicare system. The name of Mr. Obama's health care bill is the Patient Protection and Affordable Care Act. Mr. Speaker, I ask you, what type of patient protection cuts $14.6 billion from nursing homes, $112 billion from hospitals, and $135 billion from Medicare Advantage? While I'm on the record extensively for balancing the budget, I do not believe that our health care system should be made affordable on the backs of America's seniors. If the $500 billion in cuts made by Obamacare were not bad enough, this bill did nothing to address the nearly 28% cuts to physician payments scheduled for January 1st of 2012. I believe in providing access for America's seniors, not taking it away. I'm happy to announce here tonight that I'm working with members of the Doctors' Caucus, House leadership, and members across the aisle to develop legislation that will solve this issue once and for all. Mr. Speaker, tonight I call on all my colleagues to work together to ensure America's seniors that America will continue to be there for them in their time of need. I have made a pledge to seniors in my district that I will not support any changes to Medicare benefits for those 55 years of age or older. It is my belief that for those aged 54 years of age or younger, some reforms will be necessary to guarantee that Medicare remains solvent in the long term for our children and our grandchildren. Mr. Speaker, we are here tonight to show that as physicians, we want to preserve Medicare for the future. I thank Dr. Fleming for organizing this special order hour, and I yield the remainder of my time.
Well, thank you, gentlemen, for Michigan. We get world experience here tonight, all the way from OBGYNs to ophthalmologists, family physicians, nurses. So much in the way of words of wisdom, and we have so much on our side of the aisle with Republicans, as my friend points out, a dearth of available physicians, healthcare workers on the other side of the aisle. It seems a shame that we were completely closed out of the creation of and passage of the Healthcare Reform Act, which certainly suggests the need to go back and redo it. Well, we also are joined tonight by Dr. Gozar, who is a dentist and a very valued member as well of the conference. And would love to hear from you, Dr. Gozar, what you have to say this evening.
Well, Dr. Fleming, thank you so very much for organizing this hour and being able to have a fireside chat with the American public about health care and what really is coming about and what is actually going on with a broken health care system. I also want to take the time to educate, to understand, have the American people to understand what it is about a vibrant economy that actually helps our Medicare system. Now, I know the holidays are coming up, and we're going to be discussing giving a continuation of a tax holiday for many Americans, about $1,000 for an individual, on their FICA, on their withholding tax, and to employers. But I also want to take the time and to explain to the American public that there's a cost involved here. And part of that cost, when a withholding tax is taken about, goes into Social Security and partly to Medicare. And part of this is particularly Medicare Part A, the Hospitalization Act, which is the closest one for insolvency of all parts of Medicare. Now, we lost 5 years, particularly on Medicare Part A and the Hospitalization Act, just from the years of 2012 or 2010. We have yet to start looking at the disastrous parts of the economy to 2011 to be added into the insolvency. But what ends up happening is this takes a further hit in the numbers and amount of money that is actually part of the equation for our seniors in Medicare. So it's going to get worse before it gets better. And when you couple that with this administration taking, I call it stealing, over $500 billion away from the current Medicare program to build another entitlement, that's just not right. I came into Congress because I was concerned about health care. As a dentist, I love seeing a smiling face because a smiling face tells me something about vibrancy, about healthy, and participating in the greatest things that this life gives us. But it also tells me that it has to be a participating sport, and that what we have to have is a patient taken care of and being involved actively in the choices and decision processes in their health care. And that's what I want to see. I'm flabbergasted, to be honest with you, that we see a program rectifying Medicare, or attempting to through Obamacare, but then we leave the SGR fix or the physician fix completely separate. It doesn't make sense to the average person on why these aren't all integrated and part of the same equation. I also want to remind the American people, this is not an easy solution. We didn't get here overnight because we didn't do our due diligence like we had talked about earlier. We didn't change with the times as we grew older. We changed our participation and age and the variables that we had. We also enveloped technology, unbelievable things that no one in 1965 could have even imagined. They could have dreamed, but couldn't have actually imagined. And that's the other part is that we also have to look. I come from a very rural district. And what is happening back in my neck of the woods is the primary care doc, who was that gatekeeper, they're no longer around. They're either associated with a hospital or a federally qualified health center, if you can get them to see you. And that's the part that makes me also tell the American public we got another problem. You were involved in this joint committee that had Democrats and Republicans, 12 of them trying to figure out some type of a debt solution for $1.2 trillion. I want to remind the American people there's another consequence in this, not only to our military, but to our health care providers as well. Because the sequestration, when it goes through, is also going to tap, once again, the providers who are no longer being able to afford to see patients, and our hospitals, particularly those rural hospitals that will be going out of business. So there won't be an access to care. We won't have the ability to have or be a part of our own health care provider out there. So this is the dynamics that we have to take into looking at. This is the equation that's so immense. And what I've always said is start a little bit at a time. Make sure that the playing field is level, making sure that all the participants are actually there, increasing the competition, making sure the public health and the private health are all in balance, and then making sure that we have some tort reform. We have to have that. That was absolutely missing within this healthcare system. That's where we have to get back to. And we're going to have to work diligently to have sunset clauses that we reactivate and reevaluate each of the processes as our aging population gets older, as our technology gets better, and there's new advances in medicine. We have to empower people to be part of their healthcare solution and empowering them to get back in part with their physician and their healthcare system. That's what we need to do. And that's the most vibrant aspect that I can challenge our seniors. We're here for Medicare. We're here to change it in the right way. We're here to change it for you. Thank you, and I yield back my time.
Great. Well, I thank the gentleman, Dr. Gozar, and I'm just going to make a couple of closing comments, and in the few minutes that we have left, I'm going to allow some of our other physicians perhaps give some of their closing comments if they would like. And that is that one of the important things we have learned here tonight is that under Obamacare, $575 billion was cut out of Medicare. Medicare is going broke, becoming insolvent, according to the actuary, in 8 years. That's 2010. The Republicans passed a budget earlier this year that would have fixed that for good, and the Democrats have yet to even talk about it or even acknowledge that it exists, but they do know it. So I want to be sure that we leave here tonight with an understanding of the seriousness of the challenges that we have before us. And I'd like to recognize Dr. Rowe for some parting comments this evening.
Dr. Fleming, thank you. I was just looking here tonight, over 200 years of experience. What a diverse group with nursing, dentistry, family practice, OBGYN, surgery, and so on. I think one of the greatest frustrations I had when I came to Congress, and Dr. Gingrey has been here a little longer than you and I have, and one of the things I noticed on the health care debate that we had now going on 3 years ago was this. With 9 physicians, MDs, in the U.S. Congress, in the 111th Congress, not a single one of us was consulted about this health care bill. This was done on a completely partisan basis, and I have to kind of chuckle. I have never seen a Republican or a Democrat heart attack in my life. I've never personally operated on a Republican or a Democrat cancer in my life. These are people problems, as Congresswoman Burkle said just a moment ago. These are people problems that affect all of us in this country. And what we wanted to do, as I stated when we started, was to make the cost of care go down. This is not going to do this. Look, this is very simple. When we talked about the IPAB, and I think we'll have to use a different time, the Independent Payment Advisory Board, because it is so detailed. But just very briefly, this is how this works. Several of us have pointed out $575 billion taken out, 3 million seniors a year going into Medicare, reaching Medicare age, and this group of bureaucrats up here appointed, and I don't want them appointed by a Republican or a Democrat. I think the Congress ought to be accountable, and we ought to be accountable to the American people about what happens to Medicare, not push it off to some bureaucrats that are going to make these decisions, and we say, oh, I'm sorry, we can't do anything when care is denied, because when you have $575 billion less dollars and 3 million more people added per year, that's 30-something million people in 10 years. You know what that leads to, Dr. Fleming. It leads to a rationing of care, decreased access. And if you have decreased access to you as your primary care provider, it means it's decreased quality of your care and the cost is going up. That's what's going to happen with this plan. That's why it's imperative, not just Medicare, but we overturned the Affordable Care Act because it's not good medicine for patients. And if we had been included in the debate, if we simply had been included, this would not be a plan that you had to run through and get rid of the 1099 form. The IPAB is bad. It's a bipartisan bill now with 214 bipartisan co-sponsors. Those folks realize it's a bad idea. I could go on and on and on. One of the good parts of the Affordable Care Act, let's point it out, it costs more money, but allowing a 26-year-old to stay on their parents' health care plan. That's a great idea unless your parents are not paying the bill. Currently, if a young person, 22, 3 years old, gets health insurance, they'll pay 1/6 what I do. Now what's happened to them with this is it has to be a 3-to-1 ratio, so their health insurance plan costs double. And we could go on and on about the inconsistencies. And I think the previous speaker, the current minority leader, had it right when she said, let's pass it and then find out what's in it. Well, I read it, as most of us physicians did, and we found out all of the things that were in there that were not good for our patients. And we're just now discovering it's going to be less, more costly for businesses out there, and we need to have an entire hour on that. I'll yield back for closing statements.
Well, I thank the gentleman. Before I recognize another member in the last minute or two that we have, I would just like to say that we're going to be having a lot more of these sessions. And so we've just started. We've just scratched the surface. And it seems that we're really running out of time completely this evening, so I guess I'll have to wrap things up. Look, we just barely scratched the surface, folks. And this is not all the physician or healthcare workers that we have on our side. There are others here who could have been here but had some commitment tonight, but will be here next time. So we're going to be talking on these subjects. I'd love to talk more on IPAB. Even many Democrats now see that that was a very big mistake. It will be one way that you will get the door closed on your health care and getting the right sort of care in the future. So I want to thank everyone for being with us tonight. Look forward to us doing it again very soon. God bless you all, and I yield back.
The gentleman from Louisiana yields back. Under the Speaker's announced policy of January 5, 2011, the Chair recognizes the gentleman from Iowa, Mr. King, for 30 minutes.
Clear my throat. Thank you, Mr. Speaker. It's an honor to be recognized to address you here on the floor of the United States House of Representatives. And I want to say that I appreciate the presentation that came from just some of the great team of doctors we have here, especially on the Republican side of the United States Congress. And I occasionally sit with these learned individuals, and I learn a lot from them, and I'm grateful that the American people have been able to review their presentation here tonight, looking at the numbers and the dollars that have come out of the health care that because of this great burden of Obamacare. And, you know, I was thinking of the necessity for us to continue to remind Americans Obamacare is right now the law of the land. It is the law of the land, and until such time as this Congress repeals it or the Supreme Court should find it to be completely unconstitutional, it will remain the law of the land. Mr. Speaker, the American people need to be reminded that even though it's creeping in on us and as the people are realizing what Obamacare is doing to this, a few people at a time, it is an insidious creep of a malignant tumor that is metastasizing and consuming American liberty, and it has to go. And if we look back at the special elections in Ohio 2 or 3 weeks ago, and on it were several initiatives, ballot initiatives. The second ballot initiative was one that rejected the collective bargaining initiative that had been initiated by Governor Kasich. It was a tough loss for Governor Kasich. I think he was right, but he lost in the ballot place because there was a liberal-heavy, union-heavy turnout in the state of Ohio for that special election night 2 or 3 weeks ago. And by 61%, the Kasich-initiated ballot initiative that limited collective bargaining was shot down by union-heavy, liberal-heavy turnout. And they spent a lot of money in Ohio to turn out that type of a base. But in the same ballot, the next item down, ballot initiative Number 2 was collective bargaining. Number 3 was a constitutional amendment to amend the Constitution of the state of Ohio to protect Ohioans from Obamacare, to be able to reject the individual mandate, and a whole series of about 3 different points there, to amend the Constitution to protect Ohioans from the Obamacare mandate. And union-heavy, liberal-heavy turnout in Ohio that 61% said no to Governor Kasich on collective bargaining. 66% of that voting universe voted to protect Ohioans from Obamacare and to reject Obamacare by amending their state constitution. That's a serious step, to step forward and amend the state constitution, but they did so in an effort to reject Obamacare in the state of Ohio. Now, Mr. Speaker, that is a resounding rejection. I mean, that is 2 out of every 3 people that went to the polls rejected Obamacare. And I will tell you that the American people are poised to do so if they're reminded that it exists out there. And there are 2 things that protect the American people yet, 2 stops along the way that can keep Obamacare from becoming the perpetually institutionalized permanent law of the land. And that would be when the Supreme Court hears the case and yields a decision. I would remind you, Mr. Speaker, that there is no severability clause in all 2,600 pages of Obamacare. No severability clause. And what that means to the layperson is this, that if a component of Obamacare is found unconstitutional by the Supreme Court, then all of Obamacare is thrown out by the Supreme Court. There's no provision that stipulates that if a component's unconstitutional, then the other components will stand on their own. That is not just an ignorant omission on the part of the people that drafted and promoted and voted for Obamacare. They knew it didn't have a severability clause in it. I knew it didn't have a severability clause in it. That means every member of Congress had the opportunity to know that it didn't have a severability clause, so Congress willfully and intentionally passed an Obamacare piece of legislation that didn't provide that if a part of it is found to be unconstitutional, the balance of it would be found to be unconstitutional. And the important component of that then, Mr. Speaker, is this, that if a part's found unconstitutional, it's all unconstitutional. And all 2,600 pages of Obamacare then, by a Supreme Court decision, will be rendered null and void. And yes, Mr. Speaker, there are exceptions to those types of decisions by the Supreme Court. But generally speaking, the Court honors and respects a willful decision of the legislative branch. If that willful decision is that there be no severability clause, the Supreme Court should understand that that wasn't an accident, it wasn't an unintentional omission, it was a willful omission because the drafters and the proponents of Obamacare, of which I am not one, understood that if a part of it is found to be unconstitutional, the rest of it collapses anyway of its own weight. The components of this that prop up Obamacare, cutting that $575 billion out of Medicare to fund other parts of Obamacare, and then ending Medicare Advantage, the individual mandate that's in there, all of this is delicately drafted to try to find a way to argue that it could be paid for. And of course they discovered that the Class Act in Obamacare couldn't sustain itself, that the numbers that they had advanced to try to pass it aren't sustainable. And so the administration has decided they're not going to move forward with the Class Act, this piece that is, let's say, retirement home insurance funded out of Obamacare. They thought that was going to save money. They found out that it costs money, so they'll drop that. This Congress has passed a couple of repeals of pieces of Obamacare. One of them is, out of this House at least, the 1099 squeal form piece of Obamacare. So it's been taken apart to some degree. And the underpinnings of Obamacare are starting to cause it to crumble. If the Supreme Court finds any part of it unconstitutional, Mr. Speaker, they will be well aware that no severability clause does not indicate an omission by accident on the part of Congress that somehow the Supreme Court would recreate on a decision by the Supreme Court. They need to know it was a willful decision, it was premeditated, it was thought out, and the decision was no severability clause because Obamacare, well, if any part of it is taken out by it being found unconstitutional, and I believe there are about 4 areas where it is unconstitutional, then all parts of Obamacare must go. And I appreciate the doctors that came to the floor tonight to educate the American people on the bad components of Obamacare, and I'd like to encourage, Mr. Speaker, the American people to know that we are focused on repealing 100% of Obamacare, ripping it all out by the roots and leaving not one vestige of it left behind, not one particle, not one sign of its DNA. Because if we leave any component of Obamacare, it will grow back on us like the roots of a bad weed, or the virus or the malignant tumor, as I said. You can go in and take out, I'd ask the doctors this, take out a malignant tumor, and if you leave part of it, it will grow back. I don't want to leave one part of this malignant tumor of Obamacare. I want American liberty to thrive, so Obamacare must go. Ohioans have rejected it by roughly a 2-to-1 margin, 66%, and Ohio is middle America. If you're going to win the presidency, you must win Ohio. President Obama knows that. That's why he visits Ohio as often as he does with Air Force One. Or did we call that what is that? Fundraiser 1 visits these swing states, about 11 swing states with the President of the United States flying in and out of with Air Force One. Yes, just propping up public policy. No, not campaigning according to his press secretary, and we all know better. The criticism that came from the Democrats because George Bush dropped into some states that were swing states on Air Force One now becomes the responsibility of Republicans to remind the Democrats that next time this happens, you'll be hypocrites, you know. You should retract your statements now to prepare yourself for the incumbent president that will be campaigning around in Air Force One, dropping in some of these places, advancing policy in 2016. So prepare yourselves, gentlemen. Scrub it out of your history now. Recant the things you said about George W. Bush. That way you can defend the president today, and then you won't be such hypocrites in 2013 as I predict you will be. Sure, I'd be happy to yield if you had an opinion on that, but I know that you know I'm right, and you accept that. And so, the job of this Congress, the job of the American people is this: to maintain people here in the House of Representatives who are pledged to, committed to, and will pass a repeal of Obamacare again, and send it over to the United States Senate, where I'm asking, Mr. Speaker, for the American people to put senators over there that will also vote to repeal Obamacare, pledge to do so, and pledge to drive it and push it and use every fiber of their being to rip that malignant tumor Obamacare out of the Federal Register, out of the code, and give people back their American liberty. It's not enough to trust the Supreme Court to make a constitutional decision and sit back on our hands and think that somehow the court is going to save us. I remember what happened when McCain-Feingold passed, and that went to the president's desk. That was President Bush, and the word that came back, and this is rumor and conjecture, Mr. Speaker, was that the president had decided that he would sign the bill because it had such momentum when it got there, and it had political support when it got there, because he expected the Supreme Court would find McCain-Feingold to be unconstitutional. Well, over time, and thanks to Citizens United in their lawsuit, parts of McCain-Feingold were found to be unconstitutional, not all of it, and the limits that were put on free speech within that were freed up to the degree that they were litigated by Citizens United. I congratulate the people that had the vision to take it to the Supreme Court and to win the case there. But no executive officer and no member of this legislature, the House or the Senate, and Mr. Speaker, I'd send the message also to all legislators in the land, everyone in the State House in all 50 states, be you in the State House or the State Senate or in Nebraska, in the unicameral, never vote for a bill because you believe that the court will find it to be unconstitutional and protect the citizens from a bad policy or an unconstitutional policy. Mr. Speaker, we take an oath to uphold the Constitution of the United States, and that oath that we take is to defend, preserve, protect, and defend the Constitution of the United States to the words and the language that are in the Constitution, not as it would be reinterpreted by someone else, a court to be, let's say, appointed later by an executive to be elected later to amend by court decision the clear meaning of this Constitution. I'd give an example of this. In fact, the discussion came up today in the Judiciary Committee with Congressman Sensenbrenner of Wisconsin's bill that goes back to protect the property rights within the states and prohibits federal funds going into certain programs of states that violate the intent and the literal language of the Fifth Amendment of the United States Constitution. The Kelo decision, the famous Kelo decision, Mr. Speaker, I recall that unfolding here in about 2004 or 2005, when, I believe it was the City Council of New London, Connecticut, had decided that they would condemn property that was owned privately through eminent domain and then hand that property over to another private interest to be developed for a shopping mall or a strip mall, because they believed that they would get a better tax base and get a better return than they were from the individual that owned the land. Now, it directly and clearly violated, in my opinion, and I'll put my opinion up against any Supreme Court justice that disagrees with me on this issue in particular, the clear language in the Fifth Amendment of the Constitution that protects our property rights and is an essential pillar of American exceptionalism, the rights to property. It says, nor shall private property be taken for public use without just compensation. Nor shall private property be taken for public use without just compensation. And the effect of the Kelo decision by the Supreme Court, which I believe was unjustly found, is that to strike three words out of the Fifth Amendment and the Constitution of the United States. The words, for public use. So now the effect after this wrongly held Kelo decision is for the Fifth Amendment to read this way: nor shall private property be taken without just compensation. The for public use taken out of the Fifth Amendment. This Constitution has to mean what it was understood to mean at the time of ratification. It has to mean what the clear words mean in this Constitution. It can't be anything else. We can't take an oath to anything else, and we can't be bound by a later interpretation to the Constitution that someone else makes unless there is a clarity that's added to the understanding of the plain meaning and the plain words and the original text of the Constitution and the amendments as they were ratified. What did they mean when they were ratified? Mr. Speaker, we had a Supreme Court in the state of Iowa that concluded that they could find rights in the state Constitution that were, I quote, up to this point, unimagined, close quote. Seriously, judges wrapped in black robes, no longer any wigs, sitting there saying that they had found rights in the Constitution that were up to this point unimagined, and that somehow this contractual guarantee that gets passed down through the generations and the ages, this contract with American citizenship, with Iowa citizenship in that case, can be breached because they have found rights that were up to this point unimagined. Heretofore unimagined rights. What kind of guarantee can there be? A court that can discover new rights out of their imagination and declare that no one else had the imagination to discover those rights, but they had the vision to discover rights that were in this Constitution but not discovered before? That says there's no guarantee whatsoever. That says this Constitution becomes just only one of two things. It becomes an artifact of history with no meaning whatsoever, or it's a shield that the justices can use to protect themselves from the criticism of the unwashed masses, those laypersons that think that they can't read this clear language and understand it. Mr. Speaker, I'll say the people I represent can read the Constitution, they do understand it, they understand what it means, and they can make the argument with the Supreme Court justices if they were not intimidated. If they would just read the language, go to the Fifth Amendment, read the language, nor shall private property be taken for public use without just compensation. What does for public use mean if a local government can confiscate private property and hand it over to another private entity for the purposes of private use? That means they have violated the Constitution, and the bill before the Judiciary Committee today, and thanks to the Chairman Smith and former Chairman Jim Sensenbrenner, fixes that to some degree, but it doesn't repair this Constitution that is so sacred to all of us that we take an oath to it. And so I'll continue my oath and pledge to this Constitution, Mr. Speaker, and continue to make this point that we have to have constitutional legislation come before this Congress. And when someone brings a bill called Obamacare through this floor, 2,600 pages that violates so many of the components of the constitutional guarantee, let alone sapping the vitality from this very vigorous American culture that we are, the American people rise up. They rose up in tens of thousands, came to this Capitol and surrounded the place, jammed the place, so heavily that people had trouble getting in and getting out. It was a glorious thing to see, Mr. Speaker, that the American people love their liberty enough that they would come from all 50 states to jam this Capitol to say to us, do not do this. Do not commit this affront to the Constitution. Do not usurp American liberty. These are God-given rights. And who takes them away? This Congress that was led by then Speaker Pelosi and Harry Reid in the Senate and Barack Obama. The ruling troika imposed Obamacare on us, and the American people have rejected it resoundingly by sending now 89 freshman Republicans to the House of Representatives, and every one of them pledged to repeal Obamacare, and all but 2 of them, and because they haven't had a chance to do so yet, they're the special election 2, every single Republican in the House and every single Republican in the Senate voted to repeal Obamacare. And it was bipartisan. Some of the Democrats in the House voted to repeal Obamacare. The message has been sent. It's been sent in the state of Ohio. It's been sent by the polling. It goes on and on and on. Repeal Obamacare. Now, every presidential candidate on the Republican side is running on repealing Obamacare. Every one of them will sign the repeal if they're elected president and sworn into office. Now, I'd like to see us put the repeal of Obamacare, if we can't get it passed before such time as we elect a new president, whom I believe will be inaugurated January 20th, 2013, if we can't get Obamacare completely repealed before then, and whether or not the Supreme Court finds it unconstitutional, honors that there's no severability clause, and throws all of Obamacare out, it still exists within the code, and it still needs to be repealed. And the next Congress, being an honorable Congress, needs to send the repeal to the next president to be signed. And even if the Supreme Court throws it out, and even if the current president is reelected, there needs to be a repeal that goes to second-term President Obama's desk. Perish the thought if it unfolds in that fashion. But this Congress needs to act and repeal Obamacare thoroughly. And I work and I pray that we're able to put the repeal of Obamacare on the podium, on the west portico of the Capitol, January 20th, 2013, having passed the House and the Senate, not message to the White House, message to the podium on the west portico of the Capitol, moments, maybe the instant after the next president takes the oath of office, and at the words, "So help me God," I'd like to see the next president sign the repeal before he or she shakes the hand of Chief Justice Roberts, who will be issuing delivering the oath of office to the president, the next president of the United States. We have constitutional responsibilities that we have to live up to. We give an oath. Obamacare violates that Constitution. And we have some other things going on here in this government that violate the spirit of the statutes that the American people have pushed through here. And one of them is this. It's the advocacy, Mr. Speaker, of this. I've got a memo in my hand. It's dated 13 April of 2011 from the Chief of the Chaplains of the Navy. Chaplains and Religious Program Specialists. It says this, go ahead, you Navy chaplains, and you go ahead and conduct same-sex marriage services on our military bases anywhere where it's not otherwise illegal. That's the summary of it. It says that, let's see, facility usage is determined by local policies in the Region Legal Service Office. The RLSO should be consulted to ensure compliance with existing laws and regulations. Absent some existing statute, however, this is a change to previous training that stated same-sex marriages are not authorized on federal property. This memo says they are now authorized on federal property in direct confrontation with the Defense of Marriage Act, DOMA. It was passed by this Congress, signed into law clearly is the law of the land. And we have apparently a directive from the Commander-in-Chief of the United States military, Barack Obama, surely has to be the one that has ordered the Navy, you shall have, send out a memo here to direct the chaplains to conduct same-sex marriage on the basis unless there's some other law that gets in the way. I think that this kind of activity is an affront to the legislative authority that exists by the Constitution within the legislature. This is not an executive decision. This is a decision of the legislature. We passed the Defense of Marriage Act. I testified to defend the Defense of Marriage Act over in the United States Senate a month or so ago. And if the Senate were able to pass a repeal of the Defense of Marriage Act, it still has to come to the House, where I'm confident it would not pass. And I don't think it'll pass the Senate either. But in any case, we have a defiance of federal policy set by the Congress, signed by the President of the United States, from the office of the Chief of the Navy Chaplains, dated 13 April 2011, that says, don't be biased by sexual orientation when you're conducting weddings. Go ahead and marry same-sex people on these military bases anywhere where it doesn't otherwise violate a law. That tells me that that goes worldwide, bases everywhere. I suppose it's probably not happening on a base in Kuwait. They might frown on such a thing, but I don't know. And it's hard to get the facts on this. But it's hard for me also to imagine a Navy chaplain marrying a couple of Marines let's say a same-sex couple of Marines, whichever sex it might be. And this is going on in the United States of America and on bases around the country, Mr. Speaker. And it needs to come to an immediate halt. This Congress has acted on this. This House has sent the message. And, of course, you have the Senate on the other side, run by Harry Reid, one-third of the former ruling troika, that now becomes a shield for the President of the United States, and the person who carries the water for the President protects him when he doesn't want to have the confrontation himself. They've gone the other way. Now they've stricken the language out of the code. If the Senate language passes the House, they've stricken the language that prohibits bestiality in the military in their overzealous effort to try to advance same-sex marriage among our military and use it as a social experiment. The military's job is to protect our freedom and our liberty. They take an oath to the Constitution. They put their lives on the line, and we give them something that defines the federal law, that defies the federal law, the Defense of Marriage Act. Now, this is bad enough, Mr. Speaker, and I'm going to ask to introduce this into the record, and I know that I have the I guess I'll say the privilege to do that. But I'll go on to another subject matter here that's, I don't know if it's more egregious, but it's plenty bad. This is a memo dated September 14th, 2011. Department of the Navy, Walter Reed National Military Medical Center, up on Wisconsin Avenue, Bethesda, Maryland. Visited up there and visited wounded a number of times. And this memo is from the commander of Walter Reed National Military Medical Center. Subject, Wounded, Ill, and Injured Partners in Care Guidelines. Policy memo number 10-015, and there's a bunch of other stamped numbers here that do reference off of the website. And it gives some directive about the purpose, applicability, official, wounded, ill, and injured partners visits, how they should be conducted, etc. And policy according to patient and family-centered care, Mr. Speaker. Children in good health, the age of 18, are encouraged to participate. It goes on. Here's how the family should conduct themselves in visiting the wounded. Here's the intensive care units, how we would do that. Here are exceptions, visits before or after the established hours, how that might work. And then visitation for a certain kind of patients, etc. Those visiting the WII in an official capacity will make their request 5 days in advance, get in the goal line. A number of these provisions, as I read through here, the family, the leadership, members of the executive, this memo directs towards the executive, the legislative, and the judiciary branches of government, members of the executive, legislative, to include professional staff members, judiciary, active duty, general flag, and senior executive service personnel, is telling all of us, members of Congress, the President and all of his people, the judiciary, the judges, the judiciary branch, and all of their staff, well, at least the legislative staff, what we can and can't do when we visit the wounded at Walter Reed, including active duty general flag and senior executive services, celebrities, ports personnel, etc., members of the press, all these people that are listed. Here's what you can and can't do. Now, I'll get to my point here on the last page, Mr. Speaker. Partners in Care guidelines. That's all of us bound by this memo, supposedly. All family visits must be scheduled 5 days in advance, as I said. Group size can't be over 5. All partners under the age of 18 must be accompanied by an adult. Okay, fine. I'm good enough with that. Can't take pictures unless the patient agrees. Fine with that. Due to dietary restrictions and infectious disease protocols, the distribution of home-produced baked goods to the patients, families, and staff members is prohibited. You can't bring cookies to the patients. Boy, that's tough. But I wouldn't be standing here if that was the worst thing, Mr. Speaker. That's item E. I went A, B, C, D, E. Here's item F, and I'll read it into the record. Quote, no religious items, i.e., Bibles, reading material, and or artifacts are allowed to be given away or used during a visit. Close quote. Mr. Speaker, these military men and women who are recovering at Walter Reed at Bethesda have given their all for America. They've given their all for America, and they've defended and taken an oath to the Constitution, and here they are. The people that come to visit them can't bring a religious artifact. They can't bring a Bible. They can't use them in the services. A priest can't walk in with the Eucharist and offer communion to a patient who might be on their deathbed because it's prohibited in this memo from the Department of the Navy, the Commander Walter Reed, and signed, Mr. Speaker, in conclusion, by C.W. Callahan, Chief of Staff. I'd ask consent to introduce these documents into the record. And I thank the gentleman, and I yield back the balance of my time.
Gentleman from Iowa yields back.